It is now 1:08. I hope everybody enjoyed their lunch. The meeting will now come to order. The next item of business is the report of the Governor's Office of Disability Affairs. The chair recognizes Liam Doyle for the report.
You can wait a little while for people to get back on, or you can just. Okay, I can go now. Apologies, because I sent the January report, so I gave Stephanie a copy of the updated version to send out to the chat. The only major change I have is twofold. One is that our next GACT meeting is going to be on Wednesday, May 20th, and we moved it back to the press room on the fourth floor, which is our normal meeting space. That's going to be from 12:30 to 3:30. And more notably, the big thing that I want to talk to you about today is the Disability Awareness Day, which is going to take place on Monday. I think you all have the handout for that event, which is a back copy. It's the agenda and the list of our vendors. The main event is going to start. Good. We're good, okay, so don't check it. The main event's gonna start in the morning at the State Museum. We have the Secretary of LDH is gonna come and speak with Mark Raymond Jr. from the Split Second Foundation on various topics that impact the statewide disability community and do a really great fireside chat. We have some other procedural things that are gonna happen, and then from 12 to 4, we will be in the Rotunda at the Capitol, and we have 13 vendors this year that are going to be tabling and speaking to each other, legislators and members of the community to really talk about what their organizations do and kind of learn from each other and work towards their shared goals, I guess, and that's kind of the best way to put it. The big thing is what we're kind of deciding is it sounds like it's going to be a lot bigger than it was last year, which is great. So after the event, if y'all have any feedback, if you do come and as a council, as a vendor, because I know that the DD Council is a vendor, and also just in general, please let us know. We're gonna, I'm sure, put something in our newsletter for feedback for the event, because we would like to keep this going as an annual tradition. This is our second year. And I think that we've really made a lot of strides this year to kind of streamline the activities, especially in the morning. And the intention of keeping it at the museum all inside, which is good for last year was very hot. So we're trying to keep everything as cool as possible. Then we go straight from there to the Rotunda after lunch. So any feedback for that event would be great. I'm happy to answer any questions.
Thank you so much for that report. Are there any questions from council members on the report?
Council member, but staff.
Okay.
I know there was an email yesterday about if your vendors, which were one to bring your stuff ahead of time, if you have, I guess anything that's larger.
Yes.
You would have, so is the, I guess, security prepared to accept that on Friday when we show up? Or there's certain times, or you just show up
I
whenever?
believe it's, that should all be in the email. I believe if you can get it by tomorrow, because it is going to be Monday, they will accommodate that. It's just if you're available to do it earlier, that's great for them, just so they have time to go through everything. But they will do that Monday morning. We've been in contact with them.
Yeah.
Since before that email went out, just to make sure that things run as smoothly as possible. Obviously, with the construction, everything's gonna be we're gonna be a little more condensed into, where everyone's gonna be, when they first come in. So that was a bit of a concern, but we're working through that. So, as much you can, for vendors and for, members of the public, just, we ask for patience during the actual intake of that, and we will work through that. But that all should be outlined in the email. If you have any questions, you can reach out to me beforehand, or just, keep in we'll keep in contact between now and then, so if something, drastic were to change, we have talked to security about,
Okay,
being as flexible as they can with that.
yeah.
That's more of a them thing, they would like it on Friday if possible, if there's
And
any.
that's fine. I just didn't know if there was a time there was no time on Friday in particular, just say Friday.
I think it was, and they left it open on purpose.
Okay.
Because they wanted to give the vendors, those of them who could come on Friday whenever they're available.
Gotcha.
Because they didn't give us an exact time, other than the morning, they said, I think, before, or just after 8 AM and the event at the, museum starts at 9, I believe, so, yeah, so any time in there would be fine.
Any other questions? Any public comment? No public comment. Hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Governor's Office of Elderly Affairs. Chair recognizes Sherry Crane for the report.
Good afternoon, everybody. I don't know what color my paper is because I'm not there with you in person. However, I will go over my report. I'll just do the highlights. The first portion of my report just briefly states how we are the State Unit on Aging for Louisiana, and that we provide services to the Aging Network. And then it lists some of the services that are provided by our councils on aging and our area agencies on aging. And if you go down to the bottom of the first page, it gives a little bit a brief overview of our long-term care ombudsman program and what they do. The top of the second page basically gives you how many nursing homes we have in the state, along with the assisted living facilities accommodating over 44,000 residents. It also gives where we have 26 staff and volunteer ombudsmen within the program. And if you need any more information, there's the phone number that you can contact. Then in the middle of the page, we start with our elderly protective services and give some statistics since the beginning of the fiscal year, July 1 till the end of March. And we break it down into the number of reports that we get per category. Caregiver neglect is 1,170, emotional abuse 505, extortion 16, financial exploitation 2,342, physical abuse 436, self-neglect 1,712, and sexual abuse 41. That is the types of reports that we have received from July 1 until the end of March. And we had over 6,224 cases since that time frame. If you have any reports that you need to report yourself, there's numbers right there in the middle of the page, the 1-800 number. And then at the bottom of the page, we go and talk briefly about our other program, the Aging and Disability Resource Centers. We have 8 of those throughout the state. And you can have the contact number at the bottom of page 2 if you need any information about that. And the top of the next page talks about our Louisiana Medicare Improvement for Patients and Providers Act program, which is known as MIPA. It is a federal grant to help provide education, outreach, and enrollment assistance to those individuals for Medicare services, as well as low-income subsidy, and then also the Medicare Savings Plan. If you need any counseling on those, that 1-800 number is there. And then if you go to the middle of the page towards the end, just talk about some recent news. Older Americans Month is in May. The theme this year is the Champion Youth Health. This initiative places emphasis on prevention and self-management of health of seniors. The next part of our recent news is where we are tracking several bills through the legislative process. And I'll just touch on a couple of them. Of course, PCOA funding. Last year during the session, House Bill 126 was proposed to increase the amount given to our councils on aging by statute to allocate $4 per senior per parish instead of $2.50. It was approved last year. However, it was not put, the increased funds were not put in the budget. So this year, we are hopeful that the legislature will include the increase in the budget, and this will allow our councils on aging to help ease some of that strain that was during the pandemic, where they were given additional funds. Additional seniors signed up for those funds. Then, when the pandemic went away, the seniors still needed the services, but they didn't have the funds. So, this is to help fill that gap to still be able to provide those services. House Bill 102 just creates a crime of second degree cruelty to elderly and persons with infirmities. And then House Bill 204 provides for monthly financial reports to the legislative auditor from certain East Baton Rouge Parish agencies. House Bill 555 provides relative to elderly financial exploitation. 913 provides relative to protection of eligible adults from financial exploitation. That kind of strengthens the consequences for those that do exploit the seniors financially. House Bill 950 provides for consumer protection for the elderly. And then we have a couple of Senate bills. Senate Bill 38 provides relative to nursing facilities license to operate. This is more of an LDH one, but since our long-term care ombudsman goes into those nursing facilities, we're just tracking that one as well to see if there's anything that's needed from us. Senate Bill 247 requires each parish volunteer council on aging to submit certain financial information monthly to the legislative auditor. They submit financial information to us quarterly, some monthly, depending on their budget. So this just kind of puts another layer in there to ensure that they're basically operating the way that they should be operating. And then Senate Bill 259 authorizes the creation of a civil protective order online application portal. This one we are involved in. We do kind of have like a similar way that you can report, I guess, abuse, financial exploitation, any of those things against the elderly, which is just basically through our website. However, this is going to do, it makes it more, I guess more specific on the things that they can put in their order online and report to us. So this one we're watching really closely to see what we need to do to update our system and or get a different system. So these are the ones that we're tracking as of now. And of course, every day we, search any new bills that have been introduced or filed, and then we follow them accordingly as to what is going to affect our office directly. And that is it for my report. And if anybody has any questions, I'm free to answer.
Thank you, Ms. Crane. for
You're
that
welcome.
report. Are there any questions from council members? The chair recognizes Frank.
I have a question. How long is the statute of limitations on elder abuse and financial exploitation?
Unfortunately, I can't answer that specifically. That is with our Elder Protective Services unit. However, I can get the answer for you and send that to you as well as all the other members.
Thank you.
You're welcome.
Thank you, Frank. Any other questions? Any public comment? No public comment. Okay. Hearing none, the report requires no action and will be placed on file. The next item of business is a report from LRS. The chair recognizes Melissa Bam for the report.
Thank you. Good afternoon, everyone. My first two updates have already been mentioned, but they're too exciting not to kind of go over just quickly. First one I've been working on since 2022, which is that we were finally able to get a special engagement rate approved by State Civil Service. which increased our counselor pay, our entry-level counselor pay from 1718. It says 1752 in your report because that particular week, civil service changed the pay scale for all social service jobs. So technically, it changed from 1718 to 1752 that Monday, and then that Wednesday, when the special entrance rate, it changed to 2104 for our entry-level counselors. And it also included a 5% corresponding adjustment for most LRS staff, all staff in a social service rehabilitation position, which is the majority of my staff. So that was very exciting. We've been working on that for a really long time because we've had a lot of challenges with recruitment and retention. We're already seeing some success with that. We provide conditional offers of employment, and then the applicants receive those. And although salary is discussed in the applicant interview, they end up declining at that point. And we've been seeing that less already. So we're really excited about that. We're also really excited about all the gains we have been receiving in terms of state general fund. Last year, because of advocates like all of you, we've received an additional $4 million in state general fund. And this year, so far, we've gotten $2 million additional from the House. And so we are definitely very appreciative of all your efforts for that, because it's obviously very needed. And so very thankful for that. Other updates I just kind of wanted to highlight in terms of pre-employment transition services. And this was not in your report because this is new. So I wanted to let you all know. I've talked a lot about third-party cooperative arrangements, which are those contracts that we have with school districts to provide pre-employment transition services in their particular school districts. And so we have Lincoln Parish, who we are in the contracting process for. So we're going to be, we'll have that new I'm trying not to talk in acronyms, third-party cooperative arrangement in that parish soon. So we're very excited about that. These contracts allow these school districts to have their own staff to provide these services within their district. So it makes it very seamless. And so we're very excited about that contract that is upcoming. Our Workforce Innovation and Opportunity Act combined state plan, which is basically our request for funding to the federal government, is being submitted as we speak today. So we had a public comment period that ended on April the 24th. And so today was the deadline. And so our plan is being submitted today, along with all the other workforce programs at Louisiana Works and adult education. At the federal level, I just wanted to mention, we had heard that they were working on some possible interagency transfers to transfer different sections of the U.S. Department of Education to different departments. And it was our understanding that they were working on an interagency transfer to transfer the Rehabilitation Services Administration, which is where vocational rehabilitation sits, to the U.S. Department of Labor. That seems to have stalled, and we have not heard anything. At one point, we heard it was imminent, and then all talks kind of stopped. So we're really not sure what's going on there. There have been talks about dismantling the Department of Education, and then talks about not dismantling the Department of Education. I'm not sure. So we're just waiting to see what happens there. And the last update I wanted to give, which is not in your report, but it's about how so we're part of the Office of Workforce Development at Louisiana Works. And so we are in the process, or we are preparing ourselves for the new Medicaid work requirements. And just this week on Tuesday, and then again on May the 4th, the Department of Health and Louisiana Works have been holding some webinars for our staff, for our Office of Workforce Development staff. It's being hosted by Camille Conaway, who is the director of the Office of Economic Independence. She has a joint position between the Department of Health and Louisiana Works. And then Jessica Balalongo, who is the Assistant Secretary of the Office of Workforce Development. And they're providing information to our staff so that they can be prepared for some influx of participants who need to comply with the new Medicaid work requirements, which will start in January of 2027. But I believe they're going to start receiving letters next, or the first batch of letters will go out next week, I believe, at the beginning of May. So we're getting some basic information, just so that our staff knows what's going on. Our role won't be any different. We're obviously going to provide job placement assistance and work training assistance as we normally would, but we want our staff to understand. People will probably call with questions, and we're obviously being advised if they have specific questions about the requirements to direct them back to Medicaid. But we are that training is being provided to our staff so that they are prepared for that. So those are all of my comments or report.
Thank you so much, Melissa. For the report, are there any questions? Ms. Sherry? The chair recognizes Ms. Sherry.
I really don't have a question. I just wanted to answer Mr. Frank's question that he had for me on my report to the governor's office. It is a 1 year time frame for reporting.
Thank you.
Thank you.
Thank you, Ms. Sherry. Any other questions?
Yeah.
Ms. Karen, has her hand raised. Chair recognizes Ms. Karen.
I just curious, what kind of services you can talk about the independent living RV services?
So independent living this is a part of LRS that we actually sub-grant to the independent living centers throughout Louisiana. But they provide a lot of resources and information to help people basically to stay out of institutions. So they provide a lot of resources and referral services. So they provide services to individuals so that they do not go into institutions.
There was another hand.
They call part B, so there's a part A services.
So I don't know if there's a part A, but interestingly enough, there is a part C. And the independent living centers they actually receive the majority of their funds, and this is through the U.S. Department of Health and Human Services through the Part C funds, and then the Part B funds, for whatever reason, are flowed through a designated state entity, and the designated state entity for independent living is Louisiana Works for Louisiana Rehabilitation Services. Now, the Independent Living Older Blind Program is actually administered by the Rehabilitation Services Administration. And those services, we actually do provide equipment to individuals who are older blind so that they can be independent.
Any public comment? Public comment. Okay. Hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Office of Public Health. The chair recognizes Dr. Patty Baravecchio for the report.
Hey, good afternoon. So I'm not sure what color you have today because I am not in person, but the Office of Public Health is where the Bureau of Family Health sits, and we administer the state Title V program, which is a federal state partnership, and it includes the Children and Youth with Special Healthcare Needs program. And this program supports many programs and activities, services to support children and youth with special healthcare needs in the state, those with and without developmental disabilities. Some of the programs that we sponsor or support through this funding. We have some subspecialty services for pediatrics in certain areas of the state, very small footprint, but these are provided in areas where limited provider access exists. We also have a medical transportation program, and this is for families that need help getting to maybe some out of parish hospital or treatment. They must apply for Medicaid transportation. And once it's declined or they supply a justification why the Medicaid transportation is not adequate, then they can be eligible for the stipend. And we've been having a bit of an uptick of families needing this services. As you can see, there was several stipends distributed over the quarter. We also support not the transportation program. We also support our pediatric medical providers through our medical home initiative. We actually provide technical assistance, training, toolkits, all to support pediatric providers in our state with implementing universal developmental screening, holistic care coordination, and youth health transition services and supports within adolescent WellCare services. We are working to build this and expand this so that all providers in the state know where to go for these resources. You can keep going down. The Bureau of Family Health also supports our Family Resource Center. This is available to basically any family that contacts the center. It is open Monday through Friday. It is not open on state holidays. Families can request services in a preferred language by texting the center and requesting language support. But through this, they provide universal care coordination, which really focuses on that service linkage component and resource linkage. So it's a program that, as you can see, it's part of a partnership that we do with the Birth Defects Monitoring Network program. So all children identified with a birth defect, their families are contacted and provided an opportunity to receive resource and referral supports to ensure that these children receive the services and supports needed to thrive. We also, that is our outreach component, that also includes children experiencing extreme prematurity. And then we also have our incoming from the community, whether it's provider or self-referral. So families can receive universal care coordination services through the Family Resource Center, as well as like the Developmental Disabilities Council. The Bureau of Family Health works very closely with Families Helping Families through our Families Helping Families VFH project. And that is to support each other. We co-learn together and just to build a coordinated and family-centric statewide children and youth with special health care needs resource. So Families Helping Families and the Family Resource Center, they often refer to each other. But through this community level and statewide support, we ensure that all families have access to the resource and referral services they need. Families Helping Families also offers the peer support, which the Family Resource Center does not. Also under the Bureau of Family Health is the Early Hearing Detection and Intervention Program, which strives to identify children as early as possible who are deaf or hard of hearing. So they do the newborn hearing screens, and they try to meet the national standards for hearing screening by 1 month, evaluation by 3 months of age for children at risk, and then referral and enrollment in early intervention by 6 months. We collaborate with hospitals and providers across the state. They actively notify physicians with patients who need outpatient follow-up testing, and they obtain those follow-up results from the audiologist. If you want to scroll down a little bit. And they also host an advisory or facilitate an advisory council. If you're interested in more information on that, you can either register to attend, or you can also contact Louisiana EDDI at la.gov. As part of the EDDI program, there is a peer support organization called Louisiana Hands and Voices. It is a parent-driven organization to support children who are deaf and hard of hearing and their families. They advocate for families, share information, and create space and time for people to come together and help one another. So it's another great peer support organization for families of children who are deaf or hard of hearing. Keep scrolling. Our genetic disease program, if you're familiar with the Heel Stick program that happens when a newborn is born, the genetic disease program screens newborns meeting national standards and ensures access to genetic evaluation and counseling to residents of Louisiana. And the program also operates the sickle cell disease program that provides specific resources and care coordination support to families, either individuals with sickle cell disease or families that have children with sickle cell disease or trait. Keep going. And we mentioned our Louisiana Birth Defects Monitoring Network that the Family Resource Center partners with. They do surveillance for over 70 structural, functional, and genetic birth defects in Louisiana. And this is an active surveillance program that follows the CDC criteria. And this is a very active and successful program. And you can see the current stats. Their program with our FRC, we are now identifying children to contact under the age of 2. Actually, we're closer to contacting and reaching most families between 6 and 12 months. So ensuring that these children are receiving the supports that they need as timely as possible. And then the Louisiana Commission for the Deaf functions as the principal state agency that provides information and services to and for individuals who are deaf, deafblind, or hard of hearing on behalf of the state. So if you know of anybody who may be interested in that program or support services from that program, please reach out to what we call LCD. They provide a very large list of resources for that population. You could scroll up a little bit more. We also do what we call the Maternal, Infant, and Early Childhood Home Visiting Program, and this is a no-cost voluntary program that supports coaching to improve the health and well-being of pregnant women and parenting families with young children. Our Parent as Teachers program, and we also have the Nurse Family Partnership. For Nurse Family Partnership, a mom must enter the program. I believe it's prior to the 26th week's gestation, whereas the Parents as Teachers program, a family can enter that until the child, I believe, is up to 12 or 24 months. But it's a really great program. It provides health education and coaching for families. They support them in building positive parenting skills and gaining confidence in caregiving. Continue on down. And here's some, there's highlights for that program. Our provider to provider consultation line. This is an excellent resource for our healthcare providers in the state. We know we are a provider shortage area for mental health providers in many of the parishes across Louisiana. And this provider consultation line is open to providers, and they provide real-time support by a licensed mental health provider on managing mental health and behavioral health conditions in pediatric and perinatal practices. So if you are serving those to either pediatric or perinatal populations, and you have a patient or visiting your clinic and you need support with identifying an appropriate plan of care, you can call them in real time, Monday through Friday, 8 to 4:30, and they can assist you. If it's for diagnosis or medication, they will connect you to an appropriate psychiatrist. And I think last but not least, we're coming up. We have our Partners for Family Health Data Center. If you are looking for data around our population, maternal, infant, and child data, you can go to partnersforfamilyhealth.org data center that houses a lot of really informative resources on how the state of the health of that population. The Title V Maternal and Child Health Block Grant, which is our Title V work that supports the children and youth with special healthcare needs. They have been supports key policy and program advances for all mothers and children in Louisiana. And they are there. If you have questions around maternal child health policy, please don't hesitate to reach out. And I think Project SOAR, this is a HRSA grant that was focused on early childhood developmental screening and perinatal depression screening in pediatric. It stands for Screen Often and Accurately Refer. It is a 5-year initiative that will conclude in July of this year. And we have done a lot of great work engaging parents and caregivers as well as pediatric providers, and we will carry on this work through our pediatric medical home our program as we conclude that grant. And I think that's what I have. The Young Child Wellness Collaborative, which is the advisory body for the Project SOAR grant, will transition, and this cross-agency advisory council will provide support as we shift the sustainability plan for the Project SOAR to the medical home initiative. And if anybody has any questions, I'll try to answer.
Thank you so much, Dr. Barabecchio. Are there any questions from council members on the report? Any public comment? Okay. Hearing none, the report requires no action and will be placed on file. The next item of business is a report from the Office of Citizens with Developmental Disabilities. The chair recognizes Bernard Brown for the report.
All right, so we'll start with some hot topics. First on the list is the OCDD name change. As some of you may know, we actually did get a bill put up to change OCDD's name to the Office of Intellectual and Developmental Disability Supports. This bill passed out of the House unanimously and actually had 24 co-sponsors on the bill. Next steps for it is the Senate side, where hopefully we won't get too much pushback. As you all know, we reached out to everyone and had a survey. The name that we ended up selecting kind of encompassed everything in terms of the feedback. Some of the suggestions were there, and overall just kind of brings us to a space where we're acknowledging intellectual and developmental disability and not just DD. Fun part is figuring out how we're going to refer to us moving forward. Will it be OIDD or will it be Office of IDD Supports? I kind of like that one. It just rolls a little better. So that'll be just everybody getting used to shifting away from OCDD to either the Office of IDD Supports or OIDD, however we want to do it. So more to come on that. we'll keep tracking it. I don't see there being any roadblocks unless somebody just wakes up one day and absolutely hates it. But more to come on that. Another thing, over the last couple of months, some of our OCDD clinical staff collaborated with national partners to launch 2 different initiatives. The first one was an action collaborative series where our clinical director, Dr. Kelly, hosted a 4-part series with her counterpart with the National Association with Developmental Disability State Directors. That series covered continuum of supports for IDD and co-occurring behavioral needs, obviously. It actually provided a state tool that we're getting a lot of praise for. A lot of states are incorporating that tool that was developed. And it discussed the NCI data points from our NCI survey. So unfortunately, I don't think that one is available on demand. I'll check to confirm. I thought we had that in there, but if it is, you can go to the NASDs or the National Association of State DD Directors website, and there's this toolkit section where you can look at all the past resources and learning tools. We should be able to access those that series. The other part is a training series that's geared towards clinicians with the Trusted Provider Network that our clinical staff worked on. Again, it's focused on supporting individuals, again, with co-occurring. We know this is a big deal. The cool thing about this one is it is on demand, and yes, it's targeted to clinicians, but there are tips and tools to help families that have individuals they support or individuals they live with co-occurring diagnoses. You can use these trainings and this framework in everyday practice. So I would encourage folks on the phone or folks in the room to go check it out. The live sessions happen, but they are on demand. The link is in the document. Doesn't hurt to learn more. And then also from an advocacy standpoint, if you know what's available out there as far as resources to support you, you can steer people to those things. So if you know someone struggling with some behavioral things and need supports and don't know where to point them to, I would encourage you to take a look, and then you can direct somebody to these resources as well. All right. Training, again, something that's not really directed towards individuals receiving services or people receiving services, but just good to know. We had a big shift in how we do support coordination as far as the initial plan of care development. Just to give you some background, previously, when you were linked to a waiver, meaning when you got a waiver offer and you were linked to a support coordination agency, they met with you, they started developing your plan of care. Where available, they assisted you with the Medicaid application and some of that stuff. Those support coordinators were not allowed to bill for those services because the person wasn't Medicaid eligible at the time. We've actually updated our policy to where that when someone's certified, that work that was done within that time, that support coordination will be able to bill for that now. These trainings are available to help support coordination agencies understand the appropriate billing code to use and make sure that they can get the adequate payment for that initial month. So the link here is to the webinar that's on demand as well for us. And I'm sure every support coordination agency is aware of this, but just in case you may hear your support coordinator say something about not being able to bill for the time from linkage to certification, please direct them here. All right, so just quarterly activities real quick. We had 15 people in the quarter transition into the community from an institution, whether that's the Nile, the Road, Children's Choice Waiver. Our Pinecrest census is sitting about the same at 435. They've admitted 13 people, but only discharged 9. So you can see, even though it's at 35, we're still nearing the capacity that can be supported at Pinecrest. We know there's a wait list with Pinecrest. for some individuals. A lot of that wait list, I can't really speak to. I don't know why, but my best guess will probably be matching people with the appropriate homes where there are vacancies, because there are very specific homes at Pinecrest. So I'm thinking that's probably why you may see some folks on the wait list and some folks gain access to Pinecrest. So again, it's all about making sure, assuring health and safety, not just for the person who's trying to be admitted to Pinecrest, but also assuring health and safety for the residents that are currently there. So it's a really delicate balance that they have to work through. Central Louisiana Supports and Services, as you can see, their census is holding steady. They hadn't discharged anyone, and they've admitted two youths. I think I'm sorry, my cousin named you. Yeah, two youths, two kiddos, and they're holding steady as well. Another piece, our resource center. This is where our resource center, this is our clinicians and some of our allied health professionals that assist in the community. As you can see, we had about 1,700 people. I mean, not 1,700, 717 individuals received consultation from our resource center. We were able to keep 95% of those folks in the community and 98% satisfaction rate. So they're doing a bang up job, making sure people can remain in the community, folks that are in crisis or folks that just need additional supports. We had about 1,900 nurse outreaches, 177 training events. Well, we've trained, because as part of the resource center, they actually train providers and other clinicians to support our population. And we've worked with all 4 of the universities that have clinical capacity around psychology and some allied health stuff. Moving on to our just a snapshot of the waiver itself. We're at about 14,676 individuals that are receiving services. We have more than this that's actually enrolled in the waiver, but this top chart actually focuses on, of those people enrolled in the waiver, how many are receiving a paid waiver service in that quarter. And as you can see, we got about 14,000 people who are receiving services at this time. The next section, you can see the breakout by waiver type. It's interesting to point out that now is holding steady. We see a huge increase in the number of individuals in the row and in Children's Choice. Average cost is going up so far this year for various reasons. Some of it's tied to rate increases, others tied to the most appropriate waiver actually working, because the higher utilized waiver is for the individual with the higher need, right? The most comprehensive waiver. So you will see that reflected there. Next part, that's our pretty chart, talks about the breakout of participants by region. Yep, that's that one. Region 4 is still our largest region. That's the Acadiana area. 2,200 people are receiving waiver services in that area. Screening the urgency of need. We're looking at, all right, so let's go straight down to the 3s and 4s. So we're at about 25% of individuals requesting screenings are receiving a score of a 3 or 4. As you all know, a 3 or 4 is what's needed to receive a waiver offer. That's your urgent and emergent categories. We're at about 25%. That's down from last year, where we were at about 33%. There's no real explanation for why it's down, other than it's, individuals are scoring 3s and 4s. I mean, I don't know another way to kind of explain that. It's just where it is. Good thing is I haven't been receiving a ton of complaints about the SUN process as we did like last year and the year before. That was a really big issue. So I think, we've done a pretty good job of kind of working with our screeners to better articulate the process, the reason why you may not get a 3 or 4, some things like that, because I know we had a lot of discussion in the last 2 years about that process. So hopefully it's a smoother process. Also, it's good to note that initial screenings, we're actually getting to those folks to schedule those screenings within 2 weeks. How far out it is really dependent on the family's availability. So good stuff going on the screening section. And I think, geez, that's all. Are we almost done? Early steps is here still. We're still serving about 6,000 people. Throughout a year, amazingly, we're actually touching about 9,000. But as you know, kids are aging out and coming in, so the ins and out is what we call it. We're about 9,000, but actually the child count on average is about 6,000 that we're serving. Referrals are still holding steady. We're averaging about 13,000 referrals a year. That's not going anywhere, so the word is getting out about early steps. We're actually getting in and processing those referrals. So early steps is very important in the DD process. So if you know someone with a kid that may have a delay of some sort that's under the age of 3, continue to refer them to early steps. All right. Any questions? Why y'all laughing?
It's nice, thank you, Bernard. Are there any questions from council members? We have a hand raised. Chair recognize you, Ms. King.
I just wonder, what was, you said the resource center.
Yeah.
Was that, where?
Just more information about it.
That's the area, like.
Now, the resource center is statewide. It's a group of clinicians, allied health professionals, RNs, we have mental hygienists, there's social workers. The goal of them is just to kind of support individuals. Well, the objective is to support individuals to help them remain in the community, right? There are individuals that are in crisis. They offer supports. Give you one example on the allied health side. Someone might be living alone or maybe living with a relative that's now aged, that's aging and can't provide the same level of supports. We can send out our therapists, our OTPTs, come out, and the difference between keeping them in the community and having them go to the institution may be modifying their bathroom to where they can kind of have a rolling shower or a ramp or just provide environmental mods. This group, they work with the LGEs to receive their referrals and they go out and assess where needed. There may be a family that may be at their wit's end, supporting their child because of some behavioral issues. Our folks will come out, assess the situation, see if there's any treatment or any advice or anything they could coordinate to help continue to provide care in the home. If there isn't that, those clinicians also make recommendations about what next steps should be or what type of supports may be needed. Sometimes if it's episodic, they may follow along with that person for a period of time, checking in and out to see where they are. So the resource center is very instrumental in keeping folks who are in the community. So, and again, like to inquire about that, you would go through the LGE. There's a referral process. There's a whole process to get access to them. Of course, if there's the LGEs are aware, so if there's people that come up in crisis, they may reach out unprompted to pull in a resource center.
So that's just the open.
It's under OCD, yes.
So I just wonder you have a tool center, I suppose, and service center. So that's the first thing, you know, comparison to another one central. Okay. That's the only tool.
Yeah. That state-run DD facilities, yeah.
So they focus on the special people.
You have a DDSOA and they can support you there, like those are available to those folks. The special school, I mean, the Central Louisiana Supports and Services Center, that one's geared to like adolescents because it's kind of like a special school as well in one. So it's a small, more focused population and support. So it's probably a little more, I don't want to say difficult. I think there's a specific profile that goes to the Central Louisiana Support and Services. And it's different than Pinecrest. So in that respect. Yeah, both of them in the Pineville, Alexandria area, yes.
I just wonder why we not considering other location like a region.
It's a good question. That's a good question. I'll give you the history in 2 seconds. So we had 10 facilities statewide in 2008, I think, or so. And then we began the downsizing project or initiative, and we're left with 2. And those were the 2 identified to remain. So we had facilities all over the state. We downsized. I don't know. I think I was still in college when that happened. But no, I'm not aware.
It was a greater focus on community and not so much institutionalization. I'll put it that way. Services that can be received in the community and the less restrictive environment, that's where services most readily, we seek to provide services more readily in the community rather than institutionalization.
Well put, sir. Yeah.
Same thing that we did with juvenile facilities when I was with the Office of Juvenile Justice. They had juvenile facilities around the state that housed over 10,000 juveniles, and we looked to house youth in the least restrictive environment. I know the same thing was going on with adult services as well for several years.
Just feel some too far, some having part to it.
Well, I mean, we still got
They
over,
want to see
we
everything.
still got over 3,600 ICF beds in the state. So they're still there. And in those state facilities, they provide the same service as the private ICFs. Any other questions?
Ms. Melinda Elliott. Chair recognizes Ms. Melinda Elliott.
Hey, good afternoon. I'm having a little bit of trouble with the audio. Did I hear you say that, Bernard, that you weren't getting as many complaints about the Sun scores? Cause
Yep.
I'm still getting them every week or every other week.
Yep, I'm not getting them, Melinda.
Okay, so maybe this would help, what I'm working with them to do. So if I tell a parent to appeal the Sun score, how long should they be waiting to hear from someone? Is there a timeline in there?
First question is, when you say appeal, what do you mean? Like through the DAL, like through the Division of Administration, or are you talking about a reconsideration?
Okay, so how about yes, either one?
The vote. Reconsiderations happen fairly quickly. Like you can request a reconsideration, only one, of course, because you can't keep, then it's another option. So like after that initial score, if you want a reconsideration, those happen within a matter of days after your initial screening. DAL, our formal appeal process, that's handled by the Division of Administrative Law. So those time delays, and that's up to them. We don't drive those. So that could vary and that could be lengthy if they're going the appeals route. But as far as, again, reconsiderations, like once that's requested, our screening supervisor probably reaches out and does that reconsideration within a matter of days.
So
Or they're supposed to.
after a reconsideration, because you want to try the least, I think it's this, Louisiana Department of Education says the least adversarial option, right? So if I tell them to try a reconsideration, then the next step is the appeal with the Division of Administration or Division of Administrative Law, right?
Yes.
Okay, as to find out the timeline there, I need to go to them.
Yes, ma'am.
Okay, so like there's a phone number and I can just call them?
Well, yeah, I think they have a website too, but on those decision letters that you get around the screening, there's information about ways to appeal that also has the DL mail-in address and where you send the notice and all of that stuff is on the determination letter you get from the screening. But again, Melinda, if you're hearing complaints about the screenings, please shoot that to Janae Burr and Brooks Malbro. Brooks Malbro is over the screeners. We're using that information to do calibration because that's one of the things that we took away a couple of years ago when we had a lot of uptick in complaints, was that it may just be as simple as making sure we're staying in contact, or staying and continuously training and calibrating our screeners. So please send them to us, so I can stop saying the wrong thing if we do have complaints out there, so we can address it.
And yes, sir, I'm telling them to go back to not necessarily your office, but go back to the case manager and the and to MCAL. Well, and it's like everything else. You may tell people and they may not have the bandwidth to be able to get it done. But yeah, I appreciate it.
I just wanted to share my experience with Melinda. So we were screened and then I requested a reconsideration and that took like 2 weeks. And then the reconsideration, I wanted to appeal it. So I got a letter in the mail after the reconsideration saying that we had had the meeting and our score did not change. And on there was the information for the administrative law, VAL, for them. And where I could go to either submit my appeal online or to mail one in. And my experience, I mailed it in and then I didn't hear anything. And so I called and they had never received it. So I would suggest to not mail it, but to do it on their website or to talk to somebody on the phone if you possibly can. I just wanted to share my experience with you.
Yeah, that's great. That's a great description. Thank you.
Thank you, Elena.
Good to know. So it's noted for me too. Use the website. Lisa, hopefully you get a confirmation number or something.
Yeah.
Perfect.
Any other questions? Another comment? Okay. Hearing none, the report requires no action and will be placed on file. The next item of business is a report from the Office of Aging and Adult Services. Here recognizes Gary Williams in the report.
All right, good afternoon, everyone. Right, we're all of my own copy here. Again, presenting for the Office of Aging and Adult Services. We continue to face challenges with our wait list. I'll touch on a little bit, a little bit more on that a little further along what we're doing to address that. But as outlined under the waiver registry section of the report, we still have a wait list of about 6,200 folks. I'm sorry, of about 11,300. And of those 11,300, 6,200 of those are not receiving any home and community-based services. The wait time of 14.5 years, that is for individuals on the wait list, but receiving other home and community-based services. There are also a wait time of those without any services of 49 weeks. That time from linkage to certification is about 42 days. TVSCI, we have a wait list there of about 214 individuals. And most of that is due to funding for the TVSCI program. But I will say that this program has been very successful. We have made, and I need to add those stats to the report. We have made home modifications for, that has been the largest request of those with traumatic brain and spinal cord injuries or home modifications. And we've working with a couple of new providers, so we are seeing successes as it relates to those home modifications. We'll move down to adult protective services, as outlined. I'm not gonna just go through each one, but it outlines the number of cases per region by fiscal year. So for this fiscal year, as outlined, 1,388 new cases that have been accepted this fiscal year. When we go to allegations that have been investigated, that have actually turned into quote unquote cases, those numbers are outlined there. One thing that Karen requested in our last meeting, at the very note at the bottom of the grid of these 759, and I'm sorry, that should be updated to, it's a total of 915 as outlined in the chart. Of the 915 total substantiated cases in FY26, 49 of those are current OAS recipients of services. So that percentage is about 5.3, 5.4% versus the 6.4 by virtue of that being 915 versus 759. Right, the next page outlines the population of those that are receiving services, whether they're state plan services or waiver services. We highlight some things that we're doing as it relates to workforce considerations there. And I want to move to what was outlined in our report during our committee meeting, touched on HCBS strategies. We're continuing to work with HCBS strategies to address our wait list. As mentioned during the committee meeting, we want to look at a rather than first come, first serve, as it stands right now with the community choices waiver, we want to base it on acuity and those highest need. And along with that, addressing a real continuum of care. We're finding that some of those individuals that are on the community choices waiver wait list could likely receive other services that would be sufficient for their needs. That tells me that participants need to be made aware, or those on the wait list need to be made aware of other services that are available to them other than those that they're waiting for on that community choices waiver wait list. I'm also happy to announce that our program for all inclusive care of the elderly, also known as PACE. Of course, we have 4 of those PACE centers across the state right now. New Orleans, Baton Rouge, Lafayette, and Alexandria. We put out a request for information back in October, November. And we received 5 responses to that request for information. And we are now working with a vendor called Bold Age. And Bold Age will be opening our first PACE center in North Louisiana. So we're going to be opening a PACE center in the Shreveport area. So they are already hitting the ground running, making some applications, having some communications with us, some communications with CMS. And we'll be having some communication with Medicaid related to related to them moving forward and opening the PACE Center in Shreveport. One thing I want to touch on with regard to legislation, we work with the Live at Home Coalition, an advocacy group, and the Live at Home Coalition has worked with the legislature. And once again, this year we are making the recommendation for another 750 community choices waiver slots. As of right now, that is in HB1. So, and the funding associated with that is also there in HB1. We're going to work with them, and they've been very amenable to discussions with regard to funding for staff, because we want to make sure that not only do we address the waivers, but we need to be able to address the work that comes along with that. So we requested 4 additional staff members to absorb that work that will be associated with the increased number of waiver slots. In the coming weeks, we're going to be looking to do a public awareness campaign related to adult day healthcare centers, as well as our PACE centers across the state. We hope to address those, as I mentioned before, those that are on the community choices waiver wait list that could be served by a PACE center if there's one in their area, or could also be served by adult day healthcare center if there's one in the area. And we feel like a lot of those on the wait list may not have awareness of those particular services nor where they're located. So we want to do a public awareness campaign to hopefully drive some results with increased utilization of those services. All right, that's all I have.
Thank you, Mr. Berry. Are there any questions from council members? Any public comment? No.
I'm just curious, so you're also working, using the, direct worker, support worker. So that rate, you can see, we were also using the program.
It's not the same program, but we do have some of the same direct service workers and support coordination agencies that work with both of our agencies.
Okay, so the rate is, what's the rate currently? The pay rate?
I don't have that. You know what the rate is for support work? I don't know what the exact rate is.
It's like 210 a month.
For support coordination.
Yeah, 201 a month.
Yeah, it varies by program, but it's about.
I think for all of ours, except for Children's Choice, it's like 201. Children's Choice is a little less.
It's just a since recently we consider the increase that rate, we try to advocate. So I'm just curious on, you know.
And I know we're in the midst of reviewing, looking at rates right now, and we have a three, I guess, what is it, like a three-part or three-tiered review of rates right now. We've already looked at the rates on the front end. Now we are looking at the cost report analysis to make sure that we're taking everything into consideration with regard to what goes into the costs for each of those providers. And then the next thing we'll be doing is we'll be using that information to make a recommendation of what rate should be.
All right, any other comments? Hearing none, the report requires no action and will be placed on file. The next item of business is a report from the Bureau of Health Services Financing, just Medicaid. The chair recognizes Brian Bennett for the report.
Hi, everybody. My report's on the blue copy if you're here in the room. I'm gonna first go over some updates. So the first, I just wanted to let everybody know, for the Medicare Savings Program, we developed a video and it's posted on LDH's YouTube site. I have a link to it on the electronic version, but if you go to YouTube and you just search Louisiana Department of Health, it will come up. But that's also a good resource for a lot of other different educational content about our programs. Anytime we do public meetings, we try to post those on there as well. So you want to take a look at that. That has some a lot of different videos on there, but in particular, I wanted to highlight the one that we just did on the Medicare Savings Program, which provides assistance for certain low-income individuals pay for their out-of-pocket Medicare costs. Medicaid ID card redesign. So recently we sent out new Medicaid cards. So if you got something in the mail or if someone in your family got a new card in the mail, that's what that's for. The new card that was sent out was specific for, this is just your Louisiana Medicaid card. Separate and apart from if they have an MCO, they might also have an MCO card. So this was just, it was redesigned and we sent those out to members, I believe a month or so ago. In a previous meeting, I also talked about changes to our enrollment process for our managed care plans and our dental plans. So what we previously had was every year we had an open enrollment period. But we've changed recently to You can switch your plan at any time at this point throughout the calendar year, up to 2 times without pause. So, previously, we had the open enrollment period from October to December, and that was your opportunity to switch plans if you wanted to. But now, I think starting March the 1st, individuals, they can switch their plans, their MCO plans or their dental plans at any time of the year, up to 2 times in a calendar year. I've highlighted 2 state plan amendments. So the Medicaid state plan, that's our big agreement with CMS that outlines all the services, programs, eligibility categories that we have, and basically how we operate, finance, the Medicaid program. So anytime we want to make a change to services, programs, we have to do what's called the state plan amendment. And that's submitted to CMS for their review and approval before we can take action on anything. So just I've highlighted 2 in that section. One is expanding the types of providers that can deliver therapeutic services and peer support services. Those are behavioral health services. And then also a new program, it's called Thrive Kids, which will allow us to deliver kind of specialized healthcare services within schools in certain economically disadvantaged areas of the state. Both of those are still pending with CMS. We haven't gotten approval yet. So those are both under review right now. We're still continuing to meet with our beneficiary advisory council that we set up last summer, that we have meetings with that every quarter. And then for programs and services, we highlight, some of the programs and services that serve individuals with disabilities. On the very last page for the early and periodic screening, diagnostic, and treatment support coordination, I did want to highlight that. I did not include it in this report, but I will try to get it in there next time. We've recently added 2 groups to this service. So one is our ventilator assisted care program. That program's been around for, I think since the late 80s, but it provides specialized support coordination and case management to children and young adults that are on ventilators. So that previously was provided under a contract. But we recently moved that into our state plan as a formal Medicaid service. So it's technically under our EPSD support coordination umbrella right now. So I'll begin providing numbers on that in my next report. But I think right now we currently serve about 100 kids in that program. And Children's Hospital is they provide the services for that program. And then we also have our youth reentry support coordination that's also under EPSDT. So youth that are coming out of correctional facilities, most of them are Office of Juvenile Justice facilities. We provide pre-release case management and certain screening and diagnostic services to make sure that those kids are enrolled with Medicaid before they get out, and that they have a case manager working with them to try to ease them back into the community, so that any healthcare services, behavioral health services, that they have those set up when they are released. That was a program that we started last July. All 50 states were required to implement that as part of the Consolidated Appropriations Act. Few other updates that I don't have in my report, but I wanted to speak on, also related to reentry. This was just very recently, I believe it was last week. We met with CMS. I had provided an update on this throughout the past year and a half. But we had also been working on a reentry program for adults. So adults in our state prison facilities and some of our parish jails. We will also be offering reentry services for them. We will get them signed up for Medicaid, and they'll be eligible to receive a subset of services while they're still incarcerated, up to 60 days prior to release. And all individuals releasing will be eligible for those services, but who we're really trying to target are those that are releasing that may have substance use disorder service or treatment needs and or mental health needs, because just anecdotally, that's really what's, once they're released, that might put them back at re-entering incarceration. So with recidivism in mind, we really want to try to focus on addressing those substance use disorder needs and mental health needs, so that we get those services started and that they continue after release, so that that continuity of care is not interrupted when they get out. We haven't gotten formal approval from CMS yet, but we're expecting that, I think, probably in August. We're working with them right now on that. Community engagement or work requirements. Melissa had mentioned that a little earlier. And she's right. She mentioned that our initial outreach will start going out in May. We're going to have a targeted outreach where we're only looking to send notices to individuals that may be impacted by this. So all Medicaid beneficiaries will not get a notice. We're only sending those notices out to individuals who could be subject to those community engagement or work requirements. And then in August, that's when we're actually going to start starting the compliance reviews for members whose coverage renews in January. So while the community engagement requirements technically don't start until January of 2027, the renewals for January are going to start going out in November. So members will start receiving requests for information in November. So although we're not going to take any action until January, you will, if you need to verify anything, likely start receiving those notices in November. It's kind of a small portion of the Medicaid population. This just is for our adult group. Approximate numbers right here. So, and this data is a little old, so I'm sure the numbers have changed. But of about the 1.5 million members that we have on Medicaid, we're estimating about 297,000 will not be exempt from the community engagement requirements. And then of that number, we're going to try to use payroll records or any databases or data sources that we can to verify that people meet those requirements. So all in all, I think we'll probably have to send notices out to maybe about 13 or 14% of the Medicaid population when the community engagement requirements roll. So it is a smaller portion of the population, but nonetheless, we still want to make sure that those individuals know what will be required and that we give them enough time and enough opportunity to respond and give us what we need so they can keep their Medicaid coverage. Legislative session, we are monitoring 85 to 90 bills right now. A lot of them have smaller impacts on Medicaid. But it's quite a few. We are still at the point now where, as far as we are with HB1 and our funding and everything, that we're still not anticipating any cuts to programs or services. I have one quick update also for the access rule. We've mentioned that over the past year or two, Gary and Bernard might have talked about it also. But the access rule is a new rule from CMS that, it's a multi-year rule. It stretches, I think, all the way into 2030 and maybe beyond. But every year, states have to meet certain parts of that rule. So we're working with, OAS and OCDD staff right now and, Office of Behavioral Health staff to implement those that are coming due this summer. Mainly the ones that we're working on right now, there are some transparency requirements related to the money that we're spending on home and community-based services, that we have to make some updates to our fee schedules and post those online, and then just the general expenditures that we make in the programs throughout the year. So we're gonna be setting up a website for that so we can post those reports online for everybody to view if they'd like to. And then there are some new quality metrics that we'll have to start reporting on in September. So we're working on pulling those together as well. And I think that's my update. Anybody has any questions?
Thank you, Brian, so much. Any questions from council members on the report? Ms. Melinda. The chair recognizes Ms. Elliott.
Good afternoon again. So maybe you can talk to this and maybe you can't. My understanding is that there is a report that the home and community-based providers are supposed to do every year about the expenses related to waivers. And the track record for those reports being turned in is really low. Last year, we had discussions here and maybe in the SAC meeting, the State Advisory Committee meeting, about whether fines were being applied, imposed. I don't know the right words or not. Do you know about this? Can you talk about this?
Yes, I can, Miss Elliott. So those are our cost reporting requirements.
Yes, sir.
And yes, we've been imposing penalties for providers that have not submitted those timely. We did that last year and we're doing it again this year. I don't know if the penalties have gone out yet this year, but if not, they will be very soon. But yes, we have been penalizing those providers that have not submitted cost reports by the deadline.
So I don't know anything about anything, especially as I get older. My understanding is that the penalty is 5% of something, which is almost nothing.
So what we do is the penalty per month is 5% of their claims payments.
It's 5% of their what? I'm sorry.
It's 5% of their claims payments.
Okay. Which is a low figure.
Depends on what their claims payments.
Who's looking at it, right? Okay, so do y'all have any control over that 5% figure, or is it somebody else?
The department has it was the department's decision to set it at 5%.
So it is Medicaid's decision.
I would say it's LDH's because it affects Medicaid's providers, OAS's providers, and OCD's.
Okay, so it would be LDH decision. Okay, that was what I was trying to track down. Thank you very much.
But I do want to say, and you're right, the response rate for those has been a little low. So one thing that we've done, and we actually just wrapped this up. We worked with a consultant to come in and look at the cost reports to see how they might be able to be simplified, made more user-friendly. So hopefully that will kind of drive up the rate at which providers are completing and submitting those. We had work groups for our smaller providers, our medium-sized providers, our larger providers. We had work groups with sport coordination agencies, and I think our adult day healthcare centers. Where basically we went through the cost reports with them, identified what their pain points were, what would they like changed. It was just kind of a working session where we got feedback from those providers about what their experience was with completing those cost reports and what we could possibly improve. So we just wrapped up those work groups. The providers that participated in those work groups, they're going to be piloting those new cost reports this year. So we can get some feedback on it. And then we hope to deploy those, I think, next year with the new cost reports that have incorporated that feedback. So I'm sure we'll still have some providers that don't submit, but that was kind of our effort to work with providers to try to improve them, because they aren't very detailed and cumbersome, but they are that way for a reason, so we can make sure we collect all the information. But that was one thing we did in working with providers to try to improve the response rate that we get.
So do we have time for a follow-up comment?
Yes.
Yes.
Thank you. My understanding was the response rate was around 50%. And in my world, 50% might get my head chopped off. But maybe my world is different.
All I can say at this point is we did penalize those providers that did not submit a report.
Oh yeah, and I appreciate all
we're
your
trying to make-
information. Thank you.
Yeah, and we are trying to make it a little bit easier for them to complete and submit those reports. So hopefully that will help with the response rates for next year.
Thank you, Ms. Elliott. And thank you, Brian. Any other public comments? Okay. Hearing none, the report requires no action and will be placed on file. Final item of business is the report from the Department of Education. The chair recognizes Dr. Laura Wells for the report.
Hi, everyone. Good afternoon. So I think the final report for you is on this light pink paper, just an update from the Division of Diverse Learners with the Louisiana Department of Education. So the first item for you is just an update from our SEAP, our Special Education Advisory Panel. This meeting was held in March 18th, and we just discussed some different informational items around dyslexia, and specifically we have our Dyslexia Core Assessment Program. We also shared some information around up-and-coming Dyslexia Family Handbook. And then some additional reports from LDOE. We do have some revision bulletins, revisions to bulletins that are currently on notice of intent. This was based on OSEP, our Office of Special Education Programming. We received a DMS report from them, so just further aligning some language. These bulletins went to Bessie earlier this month. Some are as simple as technical edits. OSEP wanted us to include, like further define an LEA and SEA. Additional items are around dispute process. So just a quick SEAP update for you, but the materials are linked on the electronic version, and then you can also watch the live stream if you just have extra time for that. Also wanted to share an exciting event we had last month with our division. We had our leadership collaborative. So we invited 2 special education leaders from each school district to attend an in-person event in Baton Rouge. The morning session really focused on
Well, we heard a lot from the field around behavior supports for diverse learners. So really focused with our leaders on behavior. And then we had afternoon breakout sessions digging into data, discussing compliance and monitoring, and even English learner support. So that was just an exciting event. Some of those just kind of, I think, warmed my heart personally because I enjoy getting to see the different directors throughout our state. Also, just for your awareness, we currently have our IDA grant application on our website. Public comment is actually still available until 5 p.m. today. So I still wanted to list the public comment just for your awareness purposes because it is still available for the next 3 or so hours. But what this is, so our department receives our funding from OSEP, our federal organization, just around IDA, so that Individuals with Disabilities Education Act. So you can see the application is on the website. There's also what's called an interactive spreadsheet, and it just breaks down the proposed activities that align with our IDA mandates, and then the proposed budget as well. So it's just something that you're able to go see what's proposed for fiscal year 26. But again, if interested, public comment is still available for the next few hours. Also, just for awareness, we do have some legislative items, some that we're kind of monitoring more closer than others. And I've listed just 3 here for you. Brian, I hear you around 90 items. Thankfully, we don't have that many, but for special education, there's a few just for your awareness right now. So we have House Bill 342. This is around dispute resolution, that complaint process in our school systems. So right now, our legislation indicates that the individual that files a complaint, so typically a parent or a caregiver of a student with a disability, they are in charge of what's called the burden of proof. Basically, they bring forth documentation that might support, their complaints. This bill changes that burden of proof, and the LEA, our school systems, would now carry the burden of proof. So during this dispute process, if a claim is submitted, the school system would now carry that burden of proof. So that's one currently that we are just kind of watching. We also have 352. So this was as recent as yesterday a discussion, and I believe it's going back next Wednesday as well. This discusses behavioral health services in the classroom. So they're currently discussing some language. It was proposed, you can see I crossed out the word may. They have now updated that wording to shall provide services in the classroom. Again, it was discussed as recent as yesterday. It's deferred until next week. So we're just continuing to monitor 352 at this time. And then lastly, just for your awareness, this is Senate Bill 64. This is around our special education classrooms, the cameras in those self-contained classrooms. So the amendment to 64 is around the viewing procedures for when allegations of abuse arise, who views that footage. Right now, I believe the language discusses the superintendent or his or her designee. So it just really clarifies the joint viewing process with Senate Bill 64. Just a few other updates for you. So thinking about seclusion and restraint, right now, we are reminding our school systems as the end of the year is upon us that reporting process, which occurs via ESER, so our statewide process for IEP documents. So seclusion and restraint is submitted to our agency via ESER. We are also currently collecting behavior plan updates from our school systems. So just bringing that update to you around seclusion and restraint. And then a few other items just for your awareness. Our SPED Fellow Academy. So we have cohort, I believe we're on cohort 6 now. I have to count my years, but I'm pretty sure we're on cohort 6. That application process is currently available. So until May 1st, any novice special education leader, director in our school systems, they are encouraged to submit an application. And what this is, Bedfellows is a year-long, really comprehensive process to further grow those leaders' leadership skills, expand their knowledge and expertise around special education policy, even intervention and implementation. So it's just a year-long comprehensive program. We also partner our fellows with, we call that individual a coach. So they have someone to reach out directly to during this year-long process, really to walk them through their leadership, make sure they feel supported. So just bringing for your awareness, if you know anyone that might be interested, we certainly encourage them to apply. And then I think I have two more items for you. The first item is our parent involvement survey. So you can see we have our traditional school systems as well as our charter school systems that were selected for their participation in this survey. This is around what's called Indicator 18. We have to report to OSEP on a variety of indicators, and this is one of those items. So just again, bringing for your awareness, if you were aware of anyone in these school systems, making sure that they are aware of the survey. It does close July 1st, and our agency has communicated with the school leaders, letting them know that this survey is currently available and to please reach out to their parents before July 1st. And then the last item I have for you, we as a division support our students with disabilities as well as English learners. And Dr. Shinavir on our team does a fantastic job of all things English learner support. And so she hosts what's called English Learner Institutes. And the final institute for this school year, it will occur on May 14th. So just again, for awareness, if you know an interested L director or coordinator who might be interested to attend, we certainly encourage them to be there. It's a hybrid opportunity. It's occurring in person at our Claiborne building in Baton Rouge. And then she also live streams it. So just for those interested L directors or coordinators. All right, that is all I have for you today.
Thank you, Lauren.
You're welcome.
Are there any questions from council members on the report? Chair recognizes Ken.
Just heard one private person is also kind of autism. Looks a little bit hard to catch up the school study. So the school system let him to do homeschool. So I just wondered if this situation, he should be in the special class or just do home.
I would have to look more into the student specifics. If it's a student with a disability, so an IEP team decision, thinking about FAPE, free appropriate public education, what services that student needs for his or her individual needs. But we can certainly chat if you would like to about the specific student and what might best support his or her needs.
I know this kind of kids usually hard to sometimes the schools classroom setting, but just at home they still have other challenge. At home there's another people who have to be there all the time. And also if you keep isolated with other kids, it may be also not good for them. I just wonder, I know sometimes we have to take a home school as a maybe also option. Yeah, it's not that bad, but just maybe finally just still need to go back to the normal school. Maybe helpful, maybe more health for the students, the mental health. I'm just thinking, yeah. Before my son, I think they get a school aide who assigned that. I think that help a lot with the one marathon time. And this way it can help to make him calm and no big issue, and then still be good to sitting in the school in the classroom.
Yeah, a one-to-one paraprofessional, or even we call them a 2-to-1, maybe a 2-student ratio, can be determined based on that IEP team's decision. So, and it is based on that individual student's needs, academic needs, behavioral, medically fragile, are all things that are considered for that, individual child. Yeah, absolutely.
Any other questions? Public comment? Hearing none, the report requires no action and will be placed on file. At this time, we will have public comments. The public comments can be on any area of concern or question. Each person will be recognized by the chair and will have 3 minutes to speak. Are there any comments? Okay. Hearing none, we will move forward. At this time, we will have announcements. The chair recognizes Ebony for the announcements.
Okay, so we have a couple of announcements on the agenda. The next quarterly business meeting is July 29th and 30th. So we will have those 2 days again. And also don't forget, please do not forget about your financial disclosure. So we'll find you if you do not. So please submit them. Bridget and I will send out another reminder tomorrow. Tomorrow is May 1st. So you'll have 15 days to get those disclosures into the ethics board if you haven't done so already. Disability Awareness Day, I know Liam has already mentioned it, but it is May 4th. The council staff will be there. Don't forget to fill out your survey that's included in your packets, please, before you leave. And I just wanted to recognize one of the Family Service directors personally, Dr. Marilyn Thornton. She was here with us a little earlier, but she had to leave. She's retiring. And I just wanted to thank her for her service publicly in the meeting. Thank you, Dr. Marilyn. She was one of the FHF directors that attended the Capitol. Of course, she's in the greater Baton Rouge area. She attended the Capitol sessions for Yellow Shirt Day with us continuously. So I just want to thank her for her service with Families Helping Families and just let her know she's going to be missed. Thank you, Dr. Marilyn. Yes. And then one last thing, I did want to mention with the new schedule, I know that we said that expenses for the virtual meetings would not be covered, but I did want to extend this as your executive director. If there is anyone that needs assistance with hotel costs or lunch or anything like that, please reach out to me directly and we can work those things out. I don't want that to be a deterrent for individuals not to come in person. So I did want to just let everybody know that if there's any issues or if anybody needs assistance or support, we're definitely here to offer that support. So I think that's all right.
Thank you, Ebony.
I just have a question. That's for the 2 virtual. Like if we on the virtual, when we decide we want to come in person, or is that for the in-person meetings as well?
Well, no, the in-person meetings, those expenses will be covered.
Yeah, that's what I thought. Okay.
Yeah, so that is for the 2 virtual meetings.
Okay.
Anyone have any questions or comments, anything? Okay. As we close, I do just want to take a moment to thank everyone for their participation and sacrifices. The work that we do is very important, but I want you to also know that so are you. So take time to recharge, relax, take a breather. We wear many hats. Some of us are caregivers, we're parents, teachers, we have careers, we have life, okay? So I just felt led to just encourage all of you guys to take time for yourselves. Take time for you. You know, what we do is very important, but let's just try to have a healthy balance in everything that we do, okay? So in that, any further business that we need to discuss? Okay. Hearing none, if there is no objection, we will adjourn at 2:50.